How many pink things are there? Pink cans.
5.
5? Good job. Okay. How many little children are there?
The best thing about being a parent is watching your children
How
grow
many shovels?
and being confident in themselves and just being accepting of themselves, because that's so important. I feel like the one thing that you have to do as a parent is teach your children to love themselves and to respect themselves and to show them that they matter and that no matter what decision or the way they look or whatever it is, that they're always gonna be loved.
And this baby something to eat.
And they're always gonna be accepted. Liliana's a really outgoing girl. There was never a day that she was like, why am I different? Or why don't I have an ear? Liliana does not have an ear canal or anything inside her ear, so she's completely deaf from that ear. You know, they always say God doesn't give you what you can't handle. And at first, having a son who was autistic, and we found out when he was 3, and Liliana's only 18 months apart from him. So it was really hard. Like, the struggles were hard, and they still are hard. Every day we're like, you know, something new.
Hi, how are you? It's great to see you, Liliana.
No.
As a young parent, it always impresses me when families are trying to piece together what happens when their child looks different than other children. And when I first met their family, they could see that she was largely missing her right ear. But they were also seeing other things, like the fact that her chin was pointed to that side. Her teeth line, instead of being straight, was canted up on one side. She had less full cheekbones on one side. And for a lot of families, trying to figure out a unifying diagnosis is so important for them.
All right, look up at the ceiling. Good job.
So Liliana has hemifacial microsomia. That means half of the face is smaller and didn't develop as fully as the other half of the face.
Because the other elements of the ear are all missing.
So this was the real big first step for Liliana's treatment of reconstructing her ear.
Because her jaw elements are smaller on the right-hand side.
The second aspect that we've not yet addressed is her jaw development. She needs to grow a little bit more, but probably in a few years as her adult teeth are starting to come in will be the right time to do a procedure to help realign her jaws and anticipate her future growth.
From her even eyebrows. But
Our first clinic visit was really kind of an aha moment, I think, for them of realizing, you know what, all these pieces that we're seeing actually come together.
So I have an important question for you, Liliana. I'm going to start with you, and then I'm going to ask your dad, and then I'm going to ask your mom. Tell me what we're going to do in your surgery. How are we going to reconstruct your ear?
Yeah.
Any idea how? Okay, that's fair.
Plastic surgery, I think, is the perfect fit for pediatric psychology because we treat not just a condition, but a whole patient. And so kids live in families, in communities, in schools, in neighborhoods, and whatever medical condition they're managing and whatever surgery they're going through, they're doing that in a much broader system and context. So it puts kids at risk for additional social challenges like curious questions and occasionally teasing and bullying from peers. So I think when we can integrate psychology services into surgical services, we help make sure that kids understand what their choices are, what to expect, and helping the whole family navigate their care.
It's me.
That's me, yeah. I have to wear that around the hospital so everybody knows it's me.
L-E.
I have 2, yeah. When I was born, I had 2 ears.
It's okay to be different. It's okay just to be who you are. You don't have to change inside. If you feel comfortable changing your outside, you don't have to make everybody else happy. You just have to make yourself happy.
Liliana's parents are awesome because they try to put her, even as a 5-year-old, in the driver's seat and try to ask her, hey, what do you think about this? And since I have a 5-year-old right now, this is near and dear to my heart. With ear reconstruction, as we reconstruct that ear, to make that live, we have to get blood flow to it. So one of the challenges for a surgery from my standpoint is the blood supply of that flap has to work perfectly. So it's not about getting it 98 or 99% right, it has to be 100% right.
Thank you, doctor. We
You are
appreciate
so
you.
welcome. So I'll see you next Tuesday bright and early, okay?
Yeah.
So her upcoming surgery is next Tuesday. They're going to be making Liliana an ear. Now, Liliana will never be able to hear from that ear. The purpose of this surgery is to make Liliana comfortable with herself so that she doesn't have to feel like she's any different than anybody else. And what we do now will affect her in our future, and we wanted to make the right decision. And after having many conversations with Dr. Swanson, we came to just the conclusion that this is what was best for Liliana.
I mean, she is a very strong girl. And like I say, like a young age, having that kind of surgery, wow, that's amazing. I never see a child have so much like strong personality in her.
This is the beginning of her journey. This is the beginning of her story.
Who's that?
Well, guys, good morning.
Good morning.
How have you been in the last couple of weeks? Doing okay?
Little nervous, but I think that's just normal.
You know, we've talked a little bit in the past about her reconstructive journey. The thing about today is Lily's just gonna take a nap for a few hours while we do this. And if she woke up at 2 in the morning, it sounds like it's a good day to take a nap. So a little bit more about today. Surgery lasts about 6 hours or so. The nurses are gonna be giving you guys updates as we go, letting you know that things are going okay, okay? I feel like you're giving me good luck.
High five.
High five.
I love you, my girl.
You can see Liliana's future shouldn't just be a reconstructed girl with 2 ears. Today was talking about Liliana becoming a doctor, Liliana the head of the dance troupe. These are the things we want the Lilianas to be.
Well, we got a day ahead. You talk to a patient like that in pre-op, and it sure makes you want to do everything you possibly can to do as well as possible, huh? So today is a pretty special day because we're basically going to reconstruct an ear from nothing. How do we do that? Historically, people for many years and decades used parts of our body, like primarily the cartilage of the ribs, to reconstruct an ear. The challenges with that are a few, though. Taking out ribs can be very consequential. It often takes 3 or 4 ribs worth of cartilage in order to reconstruct an ear. So over the last 20 or 30 years, there's been a lot of efforts to how to do this better. We use an implant, basically porous polyethylene, which is like a medical grade plastic with pores and holes into it that the body tissue can grow into, covering it with a flap of the body's tissue that has its own blood supply and enables skin grafts to be placed over the top. It's a meticulous surgery that requires everything to come together just right.
Her external auditory canal will be right there, so let's make our measurement up from here. So I think that's going to be her effective canal. Have a good 12 centimeters up to about 13. We should be very good there for our distance.
This surgery is a really big part of Liliana's life for her. And in a physical way, and emotional. So we're just hoping that Liliana remains the same little girl that she is, because I cannot ask for anything, more than that.
I feel like we're close to something there. Cool. All right, I think we see enough here.
That's what we want to hear, the good blood flow.
Okay, we got some good stuff.
So these are the blood vessels that go through this flap. Unfortunately, these usually start right in front of the ear nubbin right here, and she has some challenging anatomy. Hers starts from behind it, so it's just going to be a challenging dissection getting that up. So the hardest thing for me about this surgery is that everything can go very smoothly during the operation.
But this is a surgery that can have a very high degree of fragility, even in the weeks and months as it's healing, and has the risk of having a devastating outcome even after the surgery.
Good. That's great. This branch right there, I think, lurking. Can we get a hook, please? Got it, Carrie. Good. Can I get a 0.5, please? Good. It says me a better match at the bottom.
We're transplanting an implant into the head and covering it with biological tissue. And if any of that biological tissue breaks down and that implant were to get exposed, it's likely going to be infected and have to be removed.
So the ear construct comes from 2 pieces. And one piece we will use to be the base of the ear, and one piece we will use to be the helix of the ear, like that. Now she's 5 years old, she's gonna grow a little bit more. Her left ear is 88% of the size of an adult female. With her hemifacial microsomia, she would have a slightly smaller ear. So all that put together, maybe we wanna go, you know, a couple millimeters bigger on this side, but probably not a lot bigger. I'm gonna start thinning this in the meantime. And this skin piece right here actually fits into a good spot.
You're connected.
Yeah, that's gonna be the contour like that. That's actually pretty good, guys.
So this is the best part of the day in many ways when we finish the procedure and we can go tell the family that it went great. And I always feel a balance here because it's tough on the parents to be anxiously waiting for 6 hours as this goes on. We're done.
Did she do good?
She did great.
Yay.
She did really well.
Thank you.
No problem. No problem. I can tell from your strong hug that it's been a long day for you guys.
Yeah.
So,
And for you as well.
you know, it's a full day. But everything went really smoothly. Beginning to end, we did it really just as we'd anticipated.
You know, this is not something that you want any child to go through. But we had to make that choice for Liliana because we want to give her the best opportunities that she has. And we want her to feel complete and whole. And you were able to give her something that we could not. So we are forever grateful for that.
Part of what we all sign up for, everybody who is involved with the Children's Hospital, is that we have to live the ups and downs of our patients and our families. I think what keeps us all feeling connected and balanced is patients like Liliana, for whom getting through surgery takes a bit of cooperation, some anxiety, but as we get through, those results totally reward the process we all commit to every day. And I think when we see this for children, we see them get through it, that smile, that happiness, that wholeness is really what drives us all forward. I'm looking for Liliana, and I know there's one place to hide in this room. So she must be right there. She's not there.
No Lily here.
All right, well, if she's left, I guess. Oh my gosh, there she is. How are you? So I want to talk to you about your new ear. Can you look in the mirror and see your new ear? What do you think about that ear?
What is that red thing?
Yeah, it's still a little bit pink, right? It's still a pink in a little bit of it. But you know what? Every week it looks less and less pink. Every week it looks more and more like your own ear, doesn't it?
It looks like this ear, right? Right.
Tell me about how you like your earrings.
Good.
Yeah, nice. Do you like that you and Mommy can wear earrings together now?
A lot of stuff. When you go in the store, you have earrings and lip gloss and makeup.
Your ears pierced?
Yeah, your ear pierced. It hurt a little bit, but it's not.
Any visit I have with Liliana, At best, I do about 10% of the time.
Kasi
We know who's in charge here.
There's always decisions to be made. Good decisions, bad decisions. But we wanted to give her that confidence when she was younger for her to build. And let me tell you, Liliana is very confident. She doesn't, she's a firecracker. She really, at this age, they don't have any sense of like, this one's different, that one's different. But as we grow, those feelings occur. And it's just a normal thing. So we didn't really want that to happen for her. It amazes me, like how just such a situation that you think is so bad in life that can turn out to something so good.